4 years we've been looking at this. We've been discussing the growing needs. And we've talked about how we can better serve those needs. And we have found that there is a need to provide short-term quality rehab in a private setting close to home. So this will be, again, a unit that will just be for short-term rehab. We expect our average length of stay to be less than 3 weeks. So you come in after a hospitalization, get your rehab, and go back home. It will be accomplished at Evergreen Pointe, where those needing rehab will receive rehab-focused care for their needs on a rehab unit that only serves those needing rehab. So none of the long-term care residents will use that unit. We'll have rehabilitation provided 7 days a week. And so Christy's going to use the little pointer, and she's going to point out there's a separate entrance. There we go. So there's a separate entrance into that part of the facility. So the colored part is the new part of the building that connects to the old part, which is not colored. And so you'll have everything that you need in this part of the facility, your own entrance, and then there's the physical therapy area up there. So we have a nice therapy gym, and then we have a dining room and a living room that's separate, and then of course your room. So the therapy gym, can you show them where the access to the outside is there?
Right here.
No, to the courtyard.
Oh, to the court.
Yeah, so that we've got from the therapy gym and from other spots, you can get directly out into this nice courtyard that we'll be adding. So that will be a benefit as well. Again, more outdoor areas. The laser grid on. Okay, so we're going to have another outdoor area. We plan on putting another pond in there, and having that be a nice area for therapy and rehabilitation. So our dining area will also provide an enhanced dining experience. So we're going to have food choices there throughout the day. There will always be salads or sandwiches, so if you want to sleep in late and get something when you wake up, although the therapy staff is probably going to wake you up. But we also are going to have a grill, made-to-order items, so it will be a little different as far as the dining goes. So the care will be provided in a setting with 14 private rooms. So all of those sort of teal colored areas are private rooms. Now Christy's got the pointer right now. That's actually the end of Maple Hall. So we're also with this project adding 7 long-term private rooms. Because one of the things that we found is there's more and more people that want a private room. So we're adding 7 to the long-term care portion of the facility to Maple Hall. And then the other ones are the 14 private rooms for the rehab unit. Having this rehab unit here in Waterloo is a benefit too because it's so close to home. So right now, sometimes people stay in St. Louis for their rehab. It's hard for the families to drive back and forth, or maybe they don't even get as many visits. And some people just like the security of knowing they're home. So this will be nice. It'll be so close to home. All the rooms will have wider mattresses. They'll have their own bathroom with their own walk-in shower, telephones, flat-screen televisions, and cable service and Wi-Fi. So we'll have RNs 24 hours a day, and they'll be specializing in rehabilitation. We'll have licensed therapists and other professional staff that are specifically focused on and trained on rehabilitation needs and returning to home. We'll have a state-of-the-art medical and therapy equipment in the rehab gym that, again, is exclusively for those on Evergreen Pointe. Medical staff with expertise in post-acute care. Our team will work with you and the hospital medical team to develop a plan of treatment that's based on your unique recovery needs. As you recover from surgery, injury, or an acute illness, Evergreen Pointe helps you make the transition to home life or home care. Evergreen Pointe teaches you new ways to care for yourself, improve your current abilities, and complete your treatment, and ultimately get you ready to go home. This is a picture of our current therapy team. So they'll be working at Evergreen Pointe as well. We have speech therapists, occupational therapists, physical therapists. They also do outpatient therapy. If you need outpatient therapy or if you want to continue outpatient therapy after you've had a stay here or a stay at the hospital, you can get that from the team here at Oak Hill. It's nice sometimes to have the same people that you've been working with follow you. So during your first day at Evergreen Pointe, the staff will develop and discuss your transitional care plan. We can meet with your family and help them fully understand your care plan, ask questions, voice any concerns, and learn how they can ensure your comfort during recovery. We'll provide comprehensive patient and family education to get you well and keep you well after you return home. And that's a big part of it, is the education. So things like if you have congestive heart failure, that you need to watch your weight, and things that you can look for as signs and symptoms. And we'll have actually people will call you from here to follow up with you. Some of the nursing, medical, and rehabilitation services that we will care for include joint replacements, complex fracture recovery, stroke and neurological rehabilitation, again, physical, occupational, and speech therapy, nutritional counseling. We have a registered dietitian on staff, pain management, IVs, and wound care. We also will be encouraging your recovery through activities such as recovery yoga, stress management, and consultation with our dietitian about healthy eating. Education with our nursing staff will be provided about managing your health after discharge. We're excited to be adding these services to better serve our community. I want to thank the community for their overwhelming support to maintain high-quality care through our community-owned home, which provides care to those who have served us in this community. So, do you have questions for me?